For those clinics that will be using WebACUTE for the outpatient ambulatory clinics, you can access your patient list by changing your rounds patient list that you see here on WebACUTE. Currently, it defaults to your rounds patient list. By selecting this button where it lists round patient list, you'll be provided with a list of other patient lists that you can use to view patients within the system. You can see here that I have scheduled outpatients as one of the options to choose from. If you do not see scheduled outpatients on your list, simply select Show All Lists at the bottom of the screen and it will provide you with a list of all the patient lists that you can choose from. To access your outpatients, you're going to select Scheduled Outpatients. When you do this, you will be brought to a list of your patients for that particular date that are scheduled for your clinic. To return to your rounding patient list, you once again select the button where the scheduled outpatients is listed and select another patient list. In this case, to go back to your rounds patient list, you would select that. Similarly, if your outpatient clinic is for surgical cases, you're going to access that list by once again changing the patient list from your rounds patient list that you see here to surgical cases. Once again, if surgical cases is not listed in the drop down menu of frequent lists that you have accessed, you can select that list by selecting Show All Lists and then selecting Surgical Cases. This will bring up your surgical cases list for the date that you select at the top of the screen here. The patient list is going to provide you with the name of your patient, why the patient has attended the clinic, for example, in this case for anemia, and in this patient's case for transfusion, as well as the time of the scheduled visit. The patient list is also going to show you when laboratory investigations, imaging, and any other notes that have been placed on the patient are available to be viewed. You will see the status indicator here on the right-hand side of the screen change color when there is information available to be reviewed in the patient's chart. Similar to other patient lists in WebACUTE, if you would like to edit the coverage of this patient list so that you include, for example, other physician providers, you can do that by selecting the little silhouette button that you see here. When you select that, you can choose Edit Coverage and apply filters that you see here to bring in further patients based upon these filters. Once you've done that, you can then toggle back and forth between your patient list that has this coverage applied, which is indicated by the button with the two silhouettes, or going back to the patient list without the coverage being applied. If you needed to switch over for another clinic, for example, if you're attending a surgical cases outpatient clinic, you can get to that list by once again selecting the Scheduled Outpatients button and selecting that surgical cases list. When you select that, it's going to bring up the patients that are listed in that clinic for that particular date selected. You also have the ability to sort the patient lists. By selecting the down arrow that you see here, you will get the column headings. You can then select the headings to sort the list in the order that is best for you. You will notice that the familiar navigation buttons are along the top of the screen, as you see here, where you can go into the patient's chart, place orders, and document. The difference being in the outpatient ambulatory setting, we would not use the discharge button, as we do not formally discharge patients from a provider's perspective when we're seeing them in the clinic. However, we are going to see that if you want to use the prescription program for doing electronic prescriptions, that will be accessed through the discharge button. But we will not be using the discharge button for the formal discharge of a patient from a clinic. When you enter the patient's chart, you will notice the familiar layout and look and feel of the chart as it is today in WebACUTE. This is because the chart is the same. It holds the same data and information from both the inpatient side of things as well as the ambulatory outpatient side of things. The difference being that your summary screen, which is created by Widgets, can contain widgets that are specific for an outpatient clinic setting. You'll notice along the top of the screen the familiar navigation bar. Here you have different buttons that can be used to access or perform different functions within the patient's chart. For example, pressing document to place documents or orders to place some orders on the patient. You can also open a chart viewer, access your sign queue, and access your workload. You will notice the Return To button at the top left-hand corner of the screen. When you select this, it's going to show you what other charts you have open. If you would like to flip over to one of the other charts that's open, you simply have to select it from the list here. It will then drop you into that patient's chart. If you have multiple charts open, it's important that you ensure that you close the patient's chart when you are done with it. When I go back to the Return To button, I can close the chart by simply selecting the X that you see here. For example, if I want to close KD trainer chart, by selecting the X, this is now going to close that patient's chart. When I go back to the Return To button, you'll see now that I just have these two charts open. The summary screen is designed by various widgets. You can select what widgets you want on your summary screen. The widgets will pull information from the patient's chart and display it on the summary screen for you to review. Although the patient's chart is the same, no matter if you're accessing it from WebACUTE or WebAmbulatory, the summary screen, however, will change when you enter from WebACUTE or from WebAmbulatory based upon the widgets that you have chosen for each of those two modules. To change the widgets that you have displayed on your summary screen, simply select the little cogwheel that you see here in the top right-hand corner. When you select this cogwheel, it's going to bring you into the Widget Preferences screen. The Widget Preference box is going to show you the widgets that are currently on the summary screen on the left-hand side and on the right-hand side. To add a widget, you simply look up the widget in the search box that you see here. For example, if I want to add the Documents widget, I select it, and it's now added the Documents widget to the right-hand side of my summary screen. You can reorganize these widgets so that they show in the order that you prefer. For example, if I want the Documents widget to show up right below the My widget, I can use these arrow keys here to move that widget to the location that I prefer. Once I've done this, I am going to select Save. And you can now see that on the right-hand column, when I scroll down, it has now included the Documents widget on my summary screen. The reference panel that you see here on the right-hand side of the screen is also composed of widgets. You can decide which widgets will make up this reference panel. To change the widgets in the reference panel, you similarly go to the cogwheel that you see here at the top right-hand corner of the screen, and this will bring up the Widget Preference box. It defaults to the summary screen widgets, which we just talked about. To change the reference column widgets, you select Reference, and then you follow the same process as that we just did for the summary screen. For example, the My widget that you see here is pulling forward from the chart operative notes, orthopedic clinic notes, discharge summaries, and the ED notes. It brings it forward with the last note for that particular category being brought forward on my summary screen. I can look at that particular operative note on November 21st, which would be the last operative note, select it, and it will pull up that note for me to review. I can also see on the left-hand column all the other documents that are available on this patient. If I select the category of just operative note within my widget, it's going to bring up just the operative notes that are available for this patient. Any information that is within the patient's chart can usually be brought forward into the My widget. For example, you can see here I've also brought in imaging reports, blood work, and vital signs. To add something to your My widget, you would simply use the right-hand click button on your mouse when you're accessing the information that you would like to bring forward to the My widget. For example, I notice on my widget that I do not have the orthopedic consult notes. If I would like to have those brought forward, I would go into the provider notes section of the chart and find an orthopedics clinic consult note. Once I find that particular orthopedics consult note, I select that category here and right click over one of the documents. It doesn't matter which document you select, as long as you select one of them in the category of the particular document you want to bring forward, in this case, the orthopedic consultation. When I right click it, it's going to allow me to add this to my widget. So I want to add this to the My widget. When you're done doing that, you would hit close. And when you go back to your summary screen, you're now going to see that the orthopedics consultation document note is now included on my widget. Moving forward, whenever I open a patient's chart, in particular in WebAmbulatory, whenever I open a patient's chart, the My widget is going to show me the information we just reviewed here, but now, in addition, any orthopedic consultation notes that are previously in the system. I can access the most recent one by selecting the document right here, or by selecting the category of orthopedic consultation, see all the previous orthopedic consultation notes for this patient. Another great area of the chart to get information in a summary-like format is using Flowsheets. If you select the Flowsheet tab, it'll bring you into the Flowsheet module. Here, you can select what type of flowsheet you would like to view. By selecting this drop-down box here, you will see various flowsheets that you can choose from. We are going to select the medical flowsheet. In the flowsheet, you can decide what information you want to view. For example, you can look at multiple visits, or you can drill down into one particular visit. For example, if I want to look at this inpatient visit here, I can select that, and it'll now bring the information forward based upon that particular visit. I can review the information in the spreadsheet that you see here, and I can decide if I want to look at the information every 24-hour period or every 12-hour period. I can decide which time frame works best for me to see that information being displayed. We're now going to place some orders on our patients. You can see the list of patients that are in my outpatient clinic. I can select the patient that I want to place orders on and select the Orders button at the top of the screen. This clinic is using WebACUTE. When I have scheduled outpatients, I could have patients that are included on this list that are currently admitted to hospital but coming down to my clinic for the particular assessment and procedure. If I select a patient that is already admitted and I go to place orders on them, it is going to go ahead and allow me to place the orders on this patient as part of their inpatient stay. However, if I select a patient that is a scheduled ambulatory patient and I want to place orders on the patient and they are not admitted to hospital, when I select the Orders button when I'm using WebACUTE, it is going to let me know that this patient is going to be scheduled in an ambulatory chart. And by selecting the Proceed to Ambulatory button will bring me into the order entry screen for this patient in WebAmbulatory. When you place orders in WebAmbulatory, you're going to notice that the order screen has a different look and feel than that of the order screen that you're used to when using WebACUTE. However, the concept is the same. You're going to find your order either through a favorite order set that you see down here at the bottom, or you're going to find the order from the catalog by searching for it in the search box. You are then going to fill out any other information that's required for that order and submit it for processing. Let's take a quick look at the order screen in WebAmbulatory. Of course, you see the very familiar navigation bar at the top of the screen. The orders section is broken down in these tabs that you see along the top of the screen in each of the sections. We have managed medications, manage discontinued medications, manage orders, and new orders by favorites and sets. The new orders by favorites and sets is going to list labs, procedures, and diagnostic imaging favorites that you have selected. Similar to WebACUTE, when you order something from the catalog and you select the star, it will then add it as a favorite under the appropriate category below. For example, under diagnostic imaging, if I wanted to add CT head without contrast, I could search for that order in the search box. And when I find the order that I want, and in this case, the CT head without contrast, I can select the little yellow star beside that order. Now that order is going to be a favorite and always available to me under the Diagnostic Imaging tab, so I do not have to search for it each time. When I refresh my screen, you can now see the CT head complex without is listed under Diagnostic Imaging as one of my favorites. You can do this for the labs, procedures, prescriptions, and referrals. We really encourage that you create favorites to make order entry most efficient, particularly in your ambulatory clinics, which are very high volume and fast paced. Unlike WebACUTE, when you place orders in Web Ambulatory, they are going to show up under the Manage Orders tab. In WebACUTE, you are likely to be familiar with the orders going to a small box at the top right hand of the screen in the Submit button, which worked almost like a shopping cart. You would place your orders and they would go into that shopping cart for processing. In Web Ambulatory, it does work similar. However, the orders will be listed here under Manage Orders when you place them. Let's go ahead and order an X-ray of the patient's left hip. I have that as a favorite down here under Diagnostic Imaging. I'm going to select that, and when I select that order, you will notice it is now listed under Manage Orders. You will also notice that there's a little red asterisk beside the order under the Manage Orders tab. This is telling us that there's more information that is required to be filled out for this particular order. To get into that order to fill out this required information, you need to click on the little arrow that you see here. It is important that you click on the arrow to open up this order to fill in any required information. If you try to click on the name of the order, such as right here where my cursor is, it's going to bring up this audit trail box. This is not what you want to open. You want to open up the information box that's asking you for information related to the order. That is accomplished by selecting the small arrow that you see here. When you select that, it is going to bring up the order details. And in this case, you can see with the red asterisk, it's asking for more information about the patient's history. I'm going to put sore hip. And then now I've fulfilled the requirements for this particular order. If I was done and I do not have any more orders to place, I could select the Submit box that you now see visible here in the top right-hand corner. The Submit box is going to submit the orders that I have under the Manage Orders tab that are new. If I want to, however, add some new orders, I can simply look up the order here in the search box or select another one from my favorites from the list below. Let's go ahead and order a CBC as well. If I select CBC, you're now going to notice that the CBC shows up under the Manage Orders tab, similar to how it did with the left hip x-ray. Again, the red asterisk is telling me that some information is required to fulfill this order. When I'm finished placing orders, I can now submit them for processing. I select the Submit box that you see here in the top right-hand corner of the screen. When I select that, it is going to show me in the background the orders that I have placed, the hip x-ray and the CBC, and it's now asking me for my PIN. Once I enter my PIN, these orders are now processed. You will now see under the Manage Orders, the CBC and the left hip x-ray that we ordered as active orders. Below that, you're going to see any other orders that are still active or outstanding on this patient. For example, in this case, this patient has frequent urinary catheter change in the urology clinic, and therefore we are seeing those orders from that series. When an order such as the CBC and the X-ray of the hip have been done and complete, they will fall off this list. You have the ability to roll up these tabs if you find that the screen is getting cluttered with past orders or orders that have yet to be complete. You can roll up these orders by selecting the little arrow that you see here. Another thing I would like to show is that if you're placing multiple orders, you do not have to go into each order at the time of ordering it to fulfill any other requirements the order is asking for. For example, if we order a dose of ceftriaxone, a x-ray of the patient's left wrist, and we want a chest x-ray as well, you can see that I have added those 3 orders under the Manage Orders tab. I do not have to go into each of these individually to fill out the required fields. Once I've selected all the orders that I want, when I submit the orders by hitting the button, it will go through each of these areas that require further information in order to complete the order. We're going to go ahead and do some documentation on our patient. This is being done in WebACUTE when this clinic is using WebACUTE for their outpatient clinics. You're going to select your patient from your scheduled outpatients list or your surgical cases list. You will select the patient and select the document button at the top of the screen. This is going to bring you into your documentation templates. Here, you can choose the appropriate template for this particular clinic. I'm going to select the endoscopy clinic note. Once I've selected this, it is now going to bring up that particular template. I can go into the different sections in this template and begin doing my dictation. In this case, I'm going to go into the narrative box and start documenting details related to the operative note based on this patient's endoscopy. We're going to go into more in-depth discussion and demonstration of documentation in the next section. In this example, I'm going to select the geriatric clinic note. I'm going to click on this template, and it's going to open up the documentation template that I can start doing my documentation on for this patient. The documentation template has a narrative text box as well as an optional assessment and plan section that can be used in addition to your narrative text. In the narrative text box, you have the ability to type your note, or you can use the voice-to-text software with the Dragon DMO. I'm going to use the Dragon DMO to do some voice-to-text narration. This patient is presenting to the geriatrics clinic in follow-up from an emergency department visit on January the 5th, 2024 period. So you can go ahead and dictate your narrative note using the front-end dictation software. I can also bring content into my note from the chart using formatted data. For example, if I wanted to bring in the patient's past medical history, I can select the little a here with a line below it and select formatted data. Here, I'm going to bring in the medical history. When I select that, it will pull it into my narrative note from the medical history that is captured within the patient's chart. I can also use quick text to bring in information by typing in a dot phrase that will pull information into my narrative note based on a template that I've created. For example, if I type in my quick text to bring up my on examination template, it'll now pull it into my note as you see here. If I want to document a normal respiratory exam, I also can use quick text that I have created to have it populate the normal respiratory exam. It is recommended that you use the assessment and plan section as well. The assessment and plan section will allow you to assign a problem or multiple problems related to the visit that you're documenting against. When you use the problem list, it's going to automatically update the active problems in the system as well as the past medical, family, and social history. You can also recall these problems when you're doing future documentation and wanting to review past documentation related to problems that this patient has presented with. I'm going to go ahead and add a problem to this patient's documentation. I'm going to add Parkinson's. You can look up the problem in the search box that you see here, and it will give you a drop-down list of problems you can choose from. I'm going to select Parkinson's disease, and this is going to be an active problem for the patient, but it's also going to be part of their past medical, family, and social history. So I'm going to select both to add this to both the patient's active problem list and to their past medical, family, and social history. When I hit save, you're now going to see that the problem Parkinson's disease has now been added to my documentation. It has also added this to the patient's chart, as you can see here under the problem list in the reference panel, as well as under the past medical, family, and social history. You will now see that Parkinson's disease is listed. I can now document an assessment and plan under the problem Parkinson's disease. I can either type this note or use the front-end dictation to provide the information related to this problem. If I wanted to add another problem, however, not a new problem, but a problem related to a past medical condition that they have, such as their congestive heart failure, I can select Add Problem and select that problem from their past medical, family, and social history, which you see here over on the right-hand side of the screen. In this case, I'm going to select congestive heart failure. I can activate this, and now it will add it to the active problem list on the left-hand side, which you see here. By selecting this box, Add to Document, I can now add that problem to my documentation, and it will now be listed here below the Parkinson's disease. When I am done, I can hit Save to save my note, which will allow me to go back and make future edits to it while it's still in the draft state, or I can go ahead and sign off the note if I am done with it. If I am done, I'm going to go ahead and hit Sign, and it's going to ask me if there's anybody else I want to copy this document to. In this case, I do not, so I'm going to go ahead and hit Save and enter my PIN number. This will now sign off my document, and it will be distributed to anybody that I had copied it to. One thing to note, unlike WebACUTE, after I've signed the document, it has not brought me back to the patient's chart. It has left me on the screen here with my signed documentation. I could, of course, add an addendum to it if I had wanted to, but if I want to go back to the patient's chart, I simply select the chart button at the top of the screen. Similarly, another difference from WebACUTE, when you save your document, if you want to leave it in a draft state, clicking the button has saved the document, and you can see it says last saved at today's date and time. However, unlike WebACUTE, when I hit save, it does not bring me back to the patient's chart. If I want to go back to the patient's chart after I've saved it, I would select the chart button. This sometimes confuses people because when you hit save, you often will wait thinking that it's going to go back to the patient's chart. However, in Web Ambulatory, it will stay in this documentation. However, note that it has been saved at the date and time that you see here. And lastly, I wanted to show you how the assessment and plan problem list can be used when you do future documentation on the patient. In this case, I've opened up another geriatrics clinic note. You will notice here on the right-hand side under the assessment plan, the button called View Previous. When I select the View Previous button, you're going to see the assessment and plan from my previous documentation where we added the Parkinson's disease and the congestive heart failure. You can also see what I entered as further information related to the assessment and plan for that problem. You can scroll through previous documentations from other visits, other specialties, to look at the problem list that was used for documentation related to this patient's care. If I want to bring in one or both of these plans into my new documentation, I would select the green arrows here. However, in this particular case, I'm going to remove the congestive heart failure and just bring in the Parkinson's disease. When I hit apply, it will now pull this in from previous documentation into my new note. Prescriptions that have been written for the patient on previous clinic visits will be shown under the Prescriptions tab in the order entry screen of Web Ambulatory. Here I can see a previous prescription for Dilaudid. If I want to provide another prescription for Dilaudid, I can select this medication, change any aspects of it if I want, or leave it the same, and queue and exit, which will now provide me a prescription when I hit submit for this hydromorphone prescription. I could then print this and then sign the prescription to be given to the patient. If I would like to prescribe a new medication for the patient, I would do this under the Medications tab that you see here beside the order entry search box. When you click this Medications tab, it's going to bring you into the order entry program for writing prescriptions. You will notice when you enter the prescription program, it shows the 2 prescriptions that have already been previously prescribed for this patient on past clinical visits. Again, similar to as I had just shown, you can select these to reorder them again if you wish. If you needed to prescribe a new medication, you would search for it here in the search box. For example, if I wanted to prescribe citalopram, I would enter citalopram into the search box, and it will provide me with the different dose strings that are available. In this case, I want to use the citalopram 20 milligram tablet. I'm going to select this. If I wanted to change the dose or change any other components of this, I can do this on the screen that you see here. I'm going to give the patient 30 tablets and no refills at this time. This is a prescription that I may often write, so therefore I'm going to select the yellow star that you see here. This will now remember this as a favorite prescription and make it a lot easier for ordering it next time. I can then hit Q and exit, and once I hit submit, it is going to provide me with a prescription for the citalopram. Again, I can hit the action of print and enter my sign password. And I now have the ability to print the prescription. This can then be signed and given to the patient to bring to the pharmacy. You will now notice when you scroll down to prescriptions, the citalopram prescription that we have just prescribed for the patient. This will also now be shown under the patient's medication list. You can see that the patient does regularly take acetaminophen, and now you can see the citalopram, which has been added to the patient's home medication list. Using the system to write prescriptions is very important because this will now add that medication to the patient's home medication list. You can see here in the reference panel the citalopram listed in the patient's home medications. By having the information in the system, not only will it aid in making it a lot more efficient for renewing prescriptions, but it will also have the medication in the system for other care providers to see what the patient is taking to ensure that appropriate treatments are done and nothing is used that may interact with that particular medication. Depending on the clinic workflow, there may be the need for the reconciliation of the patient's home medications. This can be done by using the Reconcile button that you see here. When you select the Reconcile button, it is going to list the patient's current medications that they're taking, as well as any inactive meds. This patient is currently taking the acetaminophen, and now they are taking the citalopram, which we just prescribed, and that is why you see it here with the green check mark. If we want them to continue the acetaminophen as well, we could select Confirm. When we've done this, we have now reconciled their home medications. We've advised that they continue their acetaminophen and the citalopram, which was just prescribed. I can hit Save, and now you'll see the Reconcile button has turned off. It's important to reconcile the patient's home medications at visits that are appropriate. This will help ensure that the medication list that's in the system is up to date for all care providers. At times, you may have to admit a patient from one of your ambulatory clinics. We're going to go through the process of how you would go about doing this. we're going to go into this patient's chart who is seeing us in one of our ambulatory clinics. If we need to do an admission for this patient, we're going to go into the Order Entry tab and we're going to use the Hold queue. The Hold queue will allow us to place orders for the admission of this patient, which can then be processed by registration under the correct account number when the patient is admitted. We're going to select Hold queue, and it's going to bring up the Hold queue order screen. We want to add a new event. The summary screen will show us any other Hold queue orders that are sitting on this patient's chart. At this time, the patient does not have any. We're going to select Add New Event. The type of event that we are going to enter is a direct admit. The facility will default to your facility, and you should not have to fill in this particular field. And the event date for this admission is going to be today. We are going to select today. For this particular Hold queue, we are going to select Add New because we are adding a new order for this admission to hospital. You could also use the Hold queue for adding ambulatory orders at a future date and time. In this case, we're going to just use the Add New button. When I select Add New, it is now going to ask me to enter the new orders to add to this Hold queue. This process from this point on is very similar to that of how you would admit a patient from the emergency department. In this scenario, we are going to admit a patient that we have seen in our psychiatry outpatient clinic. We're going to use the Admit Psychiatry order set. You select the order set, and then you go through the process of filling out the order set for this particular admission. We are going to select acute mental health. We are going to select a admission diagnosis, and then fill out any other particular items we want for this order set. Once we are happy with the orders, we then select Submit and enter our PIN number. You will now see that this Hold queue has the orders necessary for admitting this patient. The next step will be registration. We'll obtain a bed for the patient, and an encounter number will be made in the system. The nurse will then have the ability to initiate the Hold queue, which will activate the orders that you have placed for the patient's admission. The one downside to admitting from the ambulatory clinic using this process is that you're unable to do a medication reconciliation in the Hold queue. Once the patient has been admitted, you can then go into the patient's chart through WebACUTE and do the medication reconciliation. Now that we are done with the Hold queue, we can close it by selecting the Close button in the top left-hand corner of the screen. This will bring us back to the patient's chart. I can then go ahead and do a document, for example, a history and physical for the admission, which will then flow to the appropriate account in the patient's chart. There may be times when you have to place orders on a patient that is already admitted to the hospital but has come down to your clinic to be seen. We're going to demonstrate that in this part of the video. I'm going to go into my patient's chart. I've seen this patient in the clinic, and they are an inpatient on one of the floors. After the clinic visit, I have some recommendations for some orders. I can place those orders here so that they can be used and activated when the patient is up on the floor. To do that, I select the Orders button. It's going to bring me into the order entry screen in Web Ambulatory. To place orders on the patient that is an inpatient already, we are going to use the Hold queue. Select the Hold queue button, and it'll bring you into the Hold queue module. The process from this point is similar to what we have just shown when we admitted a patient from the ambulatory clinic. We are going to go into the Hold queue, create a new event, a direct admit, and add orderables that we want to have carried out when the patient returns to the floor. I'm going to select Add New, and in this case, we're just going to order a CBC for the patient to have done when they return to the department. We're going to select Urgent and Submit. We enter our PIN number, and now this order is available for the nursing staff to activate when the patient returns to the floor after their visit in the ambulatory clinic.